Good evening, everyone, and welcome to today's wonderful session of daily NEET PG mock test discussion. Every day when you wake up in the morning, when the sun is shining with a lot of inspiration, Bhaskaram Arogya Pradhata, when you wake up in the morning at the time of sunrise and you start your preparation, that is the best time any day for the retention, recall, reproduction in the tomorrow's exam. Thanks for joining this evening. Srijana, Sriram, Manoj, and many more who are all online. I hope you all answered the mock test downloading the Incus app. Incus app में from March 5th to April 15th. Totally 40 full-scale grand tests, each containing 100 questions. Because 200 too much होता, indigestion हो जाता, interest निकल जाता. 100 बोले तो कर सकते बैठ के एक जगह पे बैठ के. You can sit at one place and can answer. So once you take the test in the morning, you see is your score 50 by 100, 60 by 100, 70 by 100. Identify 10-15 topics where you're going wrong. Just go back to the 2000 HD videos covering all 19 subjects made available on the Incus app. Pick up those topics where you are going wrong, like Proptosis syndrome, Radial syndrome, renal tubular acidosis, amyloidosis, glomerulonephritis, schizophrenia, antidepressants. Like that, you pick up around 10-15 topics. And just those videos, do the revision. And every day evening, you have Dr. Murali Bharadwaz, your classmate, roommate, benchmate, table mate, WhatsApp mate, everywhere. The mic will be available for live discussion with you. And what more is needed? Improving every day, 10-15 topics. One day, another 30 days, you will recognize that you are very powerful. You're very strong because you fill most of the gaps. And remember, these 4,000 MCQs which we are discussing, a sure shot aane wala questions hai, these 4,000 questions. Paper out. And I also assure you that these 4,000 MCQs are from those sure shot aane wale high yield topics se hai. So that is the reason this daily mock test and these discussions, they're very, very important for you. Every year we do that. Last 60 days, we conduct 60 days daily full-scale grand test with discussion, right? So let's make the great beginning, doctor. So, what is wrong about night terror disorder? You should remember that it tends to run in families. Boys are more terrorized than girls. Do you know that? And patients are not awake. And they do not remember these episodes. And when do they occur? Night terror होता है NREM, non-rapid eye movement phase में. The night terrors basically happen. Typically during the stage 3 or stage 4 of the sleep of the non-REM is the time where night terror disorder. So typically the first 1/3 of the night during the sleep is the time where night terrors occur. Usually in the children, more common in the boys, run in the families, 1 to 6% prevalence. And often they are also, these kids also have sleepwalking disorder. So small doses of diazepam at bedtime, if at all necessary, is all that is needed. Now, a sexual pleasure in the men by rubbing their genitals against the unsuspecting women in the crowd, in the metro train, in the bus, etc. What is that called as? It's called frotterism, is what you need to remember. So pedophilia is the sexual gratification with children. Voyeurism is watching unsuspecting nude individual. Exhibition is exposure of one's genitals to strangers. Then fetishism, by touching the inanimate objects like shoes, underwear, bra, etc. If there is a sexual pleasure that comes, that is called fetishism, is what you need to remember. Transvestism is typically the men wearing women's clothes, women wearing men's clothes, especially underwear. That will give a transvestic fetishism, is what you need to remember. Frotterism, it is the sexual pressure in the men from rubbing their genitals against unsuspecting women, like in subways. Masochism, being humiliated or beaten will bring sexual excitement. And to beat, and that brings sexual excitement, hoga. Sadism, necrophilia. There are some movies also created based on the necrophilia. It is by engaging in sexual activity with the dead people. Telephone scatologia. So with unsuspecting women, engaging in a sexual conversation brings the excitement, is called telephone scatologia, is what you need to remember. So NEET PG exam mein, one of these sexual perversion disorders is one of the favorite questions of the examiner, doctor. Be very sure to be very clear about what is natural offenses, unnatural offenses. If penetration is there, without penetration, what is the definition of the offenses? Many times we discussed all this in the forensic medicine. You can kindly review that. Once more, download Incus app. Download the Incus app, doctor, and there are 2000 HD videos, each 20-30 minute video, short videos, which will give you a quick revision of all the 953 high yield topics from 19 subjects. Now, with regarding to ego uses the defense mechanisms to control all those instinctual urges. You know, an infant is a bundle of impulses. A old man is a bundle of rejection and denial. And it is that mature young man who balances between the impulsive nature versus that of denial, regret, that is common in the geriatric age group. So, id is unconscious. Ego is the mediator between id and external environment. Superego is all that moral conscience. Id is present at birth, ego present after birth, and superego is present by age 6 years. This is one of the favorite NEET PG MCQ. By what age superego will be present? By age 6 is what you should remember. Satisfying a socially objectionable impulses in an acceptable manner. What is that called? Sublimation. A guy has a impulse for nudity and a sexual perversion. So he becomes a painter and start creating some of the great paintings of nudity. Paintings, nudity is acceptable socially. Museums, everywhere you have the nudity in paintings, in sculpture, etc. That is not considered to be a social taboo. So this painter converted his impulse for that sexual perversion into art. That kind of a defense is called sublimation, is what you need to remember. Few people do donation without any requirement for mention. Please don't tell, sir, please take this $1 million. So a check is written and given. So that is called altruism, performing acts that benefit others and getting that experience of pleasure. Similarly, humor is another example of a mature defense mechanism. Then sublimation, then suppression. So purposefully ignoring an unacceptable impulse or emotion to diminish the discomfort and accomplish a task. For example, an infected wound, badly smelling, a nurse who is nauseated puts aside all those feelings and cleans the wound, is what you need to remember. Now, what are the side effects of SSRIs? The entire list you should know, doctor, because SSRIs invariably examiner पूछने वाला sure shot question है. So sexual dysfunction, GI disturbance, insomnia, headache, anorexia, weight loss. And if you combine it with MAVO inhibitors, it leads to serotonin syndrome, is what you need to remember. A 30-year-old man from Vijayawada presents with a cough, increasing shortness of breath. Chest X-ray has been shown to you. So what do you see here? Very prominent perihilar lymph nodes which are very big. They are called potato nodes. And that is very typical of sarcoidosis, is what I want to underscore to all of you. Now, doctor, a 25-year-old asthmatic individual, positive skin test for Aspergillus fumigatus, elevated serum IgE. Patient is known to be immunocompetent. So, what will be the HRCT finding? Allergic bronchopulmonary aspergillosis, ABPA. You should know the diagnosis. Diagnostic major minor criteria. So it is the central bronchiectasis is the classical feature of ABPA. So fatafat bolo, doctor, what are the major minor criteria of ABPA? Sure shot आने वाला question है. A, asthma, or radiographic fleeting pulmonary opacities. T, skin test positive for Aspergillus. E, eosinophilia. P, precipitating antibodies which are IgG in serum. I, IgE in serum elevated. Central bronchiectasis. And the serum Aspergillus fumigatus specific IgG and IgE are elevated. These are all the Rosenberg-Patterson criteria for the diagnosis of allergic bronchopulmonary aspergillosis, is what you need to remember. There is expectoration of sputum plaques, isolation of the fungus from the sputum, type 3 cutaneous hypersensitivity. They're all minor criteria for the ABPA, is what you should remember. A 46-year-old from Patna, she has severe pancreatitis, and now she developed hypoxia, which is refractory to the oxygen therapy. But there is a normal capillary wedge pressure. So that is the definition of ARDS. And systemic inflammatory Ssris. Systemic inflammatory response syndrome. So there, classically, you find a patchy peripheral air space opacification because of all that non-cardiogenic pulmonary edema. 84-year-old lifelong male smoker retired from RB, middle lobe air space opacification, Bulging of the central oblique and horizontal fissures. Bulging fissure sign. Bulging fissure sign. Where do you see? So bulging fissure sign. If you take infection, commonly infections may Klebsiella. But here there is something else. Image is being shown to you. So here you can see the collapse of the lung. So typically it is a squamous cell carcinoma. Always remember, squamous and small, they both are central located. Adeno is peripheral. Because of the central location where the trachea become bronchi, they are located and they lead to compression of that and that lead to collapse. That's what you need to appreciate. And also, there is a cavitation of this tumor. So cavitation is another important feature which is classically seen with squamous cell carcinoma is what you should remember. A 16-year-old man has been sent for chest X-ray. He has a chronic cough for 3 months. There is an underlying pneumonia and his X-ray. What do you see? You are able to see the entire right hemithorax, which is opacified. Hypertransradiant hemithorax is often a feature of pulmonary agenesis and hypoplasia, is what you need to remember. And there is also a tracheal deviation which occurred towards the side where this transradiant hemithorax is there. That is another important clue to say that it is pulmonary agenesis and hypoplasia. Then what is Mcleod Syndrome? One of the options given to you. Mcleod Syndrome hota hai late sequel of the childhood bronchiolitis with a small lung, small pulmonary arteries, expiratory aid trapping on the affected side. Now, toxic nodular goiter. Good to see 10 online students. Generally, Dr. Murali Bharadwaz Sir comes midnight masala, 10 o'clock, 11 o'clock. You thought, but today I got a very good time. I'm not that busy today in the hospital. So 6 o'clock I'm able to start the session, right? Ideally, this is a good time because the beautiful summer outside, the beautiful sunset, and you have all that energy. Unlike midnight masala, where we are all fatigued because of the day's work. 1 minute, I'll just get some water. So please tell all your friends, please share the link, download link of the Incus app, all the Telegram groups, WhatsApp groups, wherever you are located, please do post the Incus app link. We want to really make it viral and our students are our best brand ambassadors. Everybody, each of you have your own 150, 200 classmate group. So please drop asking your friends to download the Incus app. Now, which is least likely to occur in a toxic nodular goiter? The presentation is typically middle-age, overactivity of the internodular tissue. Eye signs can be there. But the goiter and hyperthyroidism doesn't appear simultaneously. So patients are in the middle or old age eye signs are frequent, goiter is present for some time before hyperthyroidism develops, not simultaneously. That is the nature of the toxic nodular goiter. Locally advanced anaplastic carcinoma of the thyroid with tracheal obstruction. How do you manage? You have to do isthymectomy. Why not tracheostomy? Tracheostomy is avoided because the place where you are making the tracheostomy opening gets invaded by the tumor. So that is the reason for the palliation, you can do isthymectomy. Which is a marker of medullary carcinoma of thyroid, doctor? Calcitonin. Riddle's thyroiditis. There is a fibrosis in the gland. The goiter may be unilateral, and the fibrosis can penetrate to the capsule of the parathyroids. Thyroid ka capsule se parathyroid ko penetrate hoega, and treatment is thyroxine replacement because it presents with severe hypothyroidism. So it has no association with hepatitis, but it has an association with retroperitoneal fibrosis and Riddle's thyroiditis. You should remember. For the hyperparathyroidism, you give estrogen, palmitoylate, a lot of water, because hyperparathyroidism में होता है hypercalcemia. Thiazides retain calcium. Furosemide, that is loop diuretics like furosemide, they lose calcium. If you have hyperparathyroidism, hypercalcemia, you want to lose or you want to retain? You want to lose. If you want to lose, then loop diuretics are preferred, not the thiazide diuretics. Primary hyperaldosteronism is because of the adrenal adenoma, not adrenal hyperplasia. It is not the hyperplasia, but adenoma of the zona glomerulus. So Conn syndrome is more common in the women, and aldosterone will cause the kaliuresis. Potassium is lost into urine. And anti-mineralocorticoid drug like spironolactone is considered first-line treatment whenever there is hyperaldosteronism is what you need to remember. Where do we use high-dose dexamethasone suppression test? Whenever patient is having hypercortisolism, if you want to know whether it is due to pituitary adenoma, or is it because of ectopic KCTH? If you want to know whether is it because of this or this. So what will you do? You give high dose dexamethasone suppression. Pituitary adenoma hai to it will get suppressed. But ectopic KCTH does not suppress. That is how high dose dexamethasone suppression test will differentiate between pituitary adenoma versus ectopic ACTH. A young woman, increased breast tenderness before periods, bilateral ill-defined lumpiness. So you need to do mammography, exclude caffeine from the diet, give breast support. So this is called cyclical mastalgia with breast lumpiness, which can occur typically whenever there are hormonal aberrations in the normal involution and development of the breast. So there, when there is no discrete lump, FNAC has a very little value. Phyllodes tumor, they are rarely fixed to the chest wall. Though they are very big, they are not fixed to the chest wall. But they may metastasize to the bloodstream. Local radiotherapy after mastectomy. What are the indications? Any medial quadrant tumor, node positive tumor, large high-grade tumor, they're all the specific indications where after removing the breast also, still you will give radiotherapy. So I leave the literature for you. What are all the scenarios where post-operative radiotherapy is given after mastectomy in the case of the breast carcinoma? With regard to the tamoxifen, it will typically decrease both the recurrence rate, death rate in case of breast cancer patients. Estrogen receptor positive hypo, it is very, very beneficial. It reduces the risk of the tumor in the contralateral breast. They're all true. But it should be given for 5 years is what you should remember. A systolic murmur with the tall R waves in the lateral leads means left ventricle got hypertrophy. So examiner is simply asking you, typically, where do you see left ventricular hypertrophy? So the lateral leads are what? V6, V5. So that they are looking at left ventricle. So tall R wave in these leads means left ventricular hypertrophy, which typically happens in case of aortic stenosis, which also has a systolic murmur. Subclavian artery stenosis, percutaneous transluminal balloon angioplasty is considered to be the management of choice. AV fistulas, they lead to hyperdynamic circulation, short circulatory time, increased cardiac output, overgrowth of limb, tachycardia, but a wide pulse pressure. Systolic is somewhere 140, 150, diastolic 30, 20, wide pulse pressure. Wide pulse pressure is a feature of AV fistula, is what you need to remember. Now, thromboangiitis obliterans. It can give rise to Raynaud's. Medium-sized arteries get occluded. Often superficial deep veins show thrombophlebitis. It does not occur in women. It does not occur in non-smokers. There are the two principles about the Buerger's disease. Varicose veins in the legs can occur because of pregnancy or barber surgeons who stand for a long time. Renal tumor hai to varicocele will be there. Varicocele, not varicose veins. Now, esophagus. Esophagus has a sparse nerve supply in Meissner's corpuscles. Primary peristalsis is under vagal control. Cricopharyngeal sphincter is a voluntary muscle. And 2 centimeters of the esophagus is intra-abdominal, is what you should remember. Boyer-Harvey syndrome. After vomiting, profuse vomiting, esophageal perforation is called Boyer-Harvey. Where does it happen? It is the lower 1/3 of the esophagus is a classical location, and it requires surgery. Achalasia cardia. Typically, there is a dilated segment and there is a narrow segment. That's called rat tail appearance. So, a dilated segment jo hota hai, that is a ganglionic segment is what you should remember. Marked weight loss, diarrhea with meals, history of vomiting, feces. He has undergone vagotomy, gastrojejunostomy. How do you want to evaluate? Barium enema. So post peptic ulcer surgery, there can be a gastrojejunocolic fistula. See the colon and stomach के बीच में English channel बन गया. So that is the reason these people will typically show the presence of feculent vomiting is what you should remember. A patient treated for peptic ulcer has undergone venotomy, anthrectomy, and included distal 30% of the stomach resection. That can lead to everything, diarrhea, gall stones, gastric cancer. But vitamin B12 deficiency only if there is a total gastrectomy, not a partial gastrectomy. Perforated duodenal ulcer hai to, you will try to apply a omental patch and seal it. You don't go for any vagotomy, pyloroplasty, like definitive surgeries you don't do. A carcinoma, parathyroid adenoma, they're all associated with the Mcleod syndrome. Tails, pukes classification. Banana, bilirubin, albumin, encephalopathy, but not PT. So PT is important, but it is not included in the child system. A young man has abdominal discomfort due to a large intrahepatic unilocular cyst. How do you treat? You have to do a surgical deroofing. So what the patient is having is a simple cyst of liver. They're often asymptomatic. If symptomatic, they should be deroofed laparoscopically. A young lady to undergo laparoscopic cholecystectomy, recurrent biliary colic due to the Gall Stones. What do? We do liver function test, alkaline phosphatase, PT, hemogram, etc., etc. So these are the intrahepatic ducts. This is the pancreatic duct. This is the common bile duct. This is the duodenum, and it is opening over here. So for the Gall Stones, MRCP is not a routine investigation. On the day one after difficult laparoscopic cholecystectomy, there is a bilious discharge with a 16F drain placed in the subhepatic space. So what is the management? So you should remember, this patient has a small bilious discharge. Generally, it will subside on its own. So give antibiotics and observe for next 3 to 4 days. If it does not subside, then do ERCP and then stenting should be planned. After cholecystectomy, patient develops obstructive jaundice. After cholecystectomy, there's a dilatation of upper biliary tract, suggesting that there may be a stricture in the bile duct. So what is the best investigation for the stricture in the bile duct, doctor? It is percutaneous transluminal cholangiography, PTC. ERCP will confirm the stricture, show the obstruction is a stricture but not a stone. It also helps to remove the residual stone. And the ERCP is the best guide for further surgery of the stricture. But what is the disadvantage of ERCP? It cannot show the upper end if the block is complete. And also it is a very invasive evaluation. MRCP that way is much better than ERCP with the help of MRI to identify the post-operative stricture. Most pancreatic carcinomas, they're all duct cell adenocarcinomas. Duct cell adenocarcinomas. A patient diagnosed to have peritonitis due to perforation. What is the management? Analgesics, proton pump inhibitors, 4 to 8 hours of fluid therapy. They're all the part. And any delay in surgery To give fluid therapy, you can delay a little, but not to see whether antibiotics work or not. No, no, no. For that reason, you don't delay. Now comes a very interesting orthopedics question, doctor. Cotton's fracture. It is a trimalleolar fracture. So the medial malleolus and fibula, along with the posterior tip of the articular surface of the tibia, they're all fractured and displaced. Now, अभी मैं एक मसाला टॉपिक बोल रहा हूं डॉक्टर. Definitely, I'm giving you assurance. One MCQ is going to come from the next 10 slides that I'm going to discuss. One MCQ, either image-based MCQ आएगा or theory. I mean clinical vignette based. Definitely आएगा कल के नीट पीजी में one of this. मेरा assurance लिख लो आप. अगर नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं. Jefferson's fracture, atlas vertebra. Monteggia is mountain, so proximal third of the ulna with dislocation of proximal radioulnar. Galeazzi, galees नीचे होता है, so distal third of the radius with the dislocation of the distal radioulnar. This is called Hangman's fracture, which is the axis vertebra, C2. Clay-Schwaller's fracture, which is a fracture of the spinous process of the C7 vertebrae. Colles, you all know. It is the distal metaphyseal fracture of the radius with the dorsal displacement and dorsal angulation. Smith क्या होता है डॉक्टर? Smith होता है reversal of the Colles. Then Barton's fracture. It is a fracture through the articular surface of the distal radius with the subluxation of the wrist. Choffer. It is the radius का styloid process. Fracture of the radial styloid. Very good to see Arboretum and many more who are all online. भैया मैं रोज लेट आता हूँ, आज तो टाइम पे आ गया गाड़ी. That's the reason a lot of our classmates missed the class today. But please sign on. Please click on the notification button, doctor. If you click, no, it will give before half an hour, it will send you a notification, YouTube. Choffer's fracture is the radial styloid fracture. Night stick fracture is isolated fracture of the ulnar shaft. Bennett's fracture, it is the partial fracture of the first metacarpal base with the trapezium with a metacarpal joint dislocation. Rolando is a comminuted intra-articular fracture of the base of the first metacarpal. Potts is a bimalleolar medial lateral malleolar fracture. Cotton's होता है trimalleolar medial lateral and posterior malleolar fracture. Pilon's fracture, whenever a large force drives the talus is called the key bone of the ankle. If it drives the talus upwards against the tibial plateau, then you call pilon fracture. So this is typically the pilon fracture. You should not miss. March is a stress fracture of the second metatarsal neck. Jones is the fracture of the fifth metatarsal. So that is the story of the various named fractures. If you fall from the height, calcaneum can fracture, base of the skull can fracture, 12th thoracic vertebra can fracture, but fibula does not, because it does not lie in direct axis of the weight transmission. A patient develops compartment syndrome after you have put the plaster for the fracture. And how do you manage? you do operative decompression of the facial compartment is considered to be the treatment for compartment syndrome. A 30-year-old man with road traffic accident, fracture of the femur, developed sudden breathlessness. That is the story of fat embolism. Telescopic test with an increased mobility of the joint is a feature of intracapsular fracture neck of femur. About the dislocation of the hip. Posterior dislocation is more common. Posterior dislocation, the whole lower limb is rotated medially. Anterior dislocation, where whole lower limb is rotated laterally, is what you need to remember. 1 week old fracture neck of femur in a 65-year-old. How do you want to manage? You have to do close reduction, internal fixation with a cannulated cancellous screws. The femoral head should not be sacrificed lightly in every fracture, particularly when the fracture is undisplaced or it can be reduced accurately. You should not lose the head. Now, if a patient with suspected fracture of the pelvis is showing bleeding from urethra, unable to pass urine, what do you want to do? He should be prepared for surgery and catheterization is attempted in the OT. Otherwise, if you try to pass the catheter, it can convert a partial into a complete urethral tear, is what you should remember. Mid-palmar space ends into the web space. Then, with regard to the scaphoid fracture where non-unions are more common for the scaphoid fracture. So, doctor, take a break. We will take a 5 minutes break. After break, we will try to finish. After break, we finish remaining 50 MCQs. Meanwhile, please download Incus app. Right, doc? Yeah, welcome back everyone, and let us finish the second round of 50 more questions. I hope you're all ready. Meanwhile, I hope you all have downloaded the Incus app if you have not yet downloaded earlier. Paralytic squint, non-paralytic squint. इसके पहले भी मैंने बोला, अभी भी बोल रहा हूं, कल भी बोलूंगा. Strabismus, sure short topic of the examiner. Paralytic versus non-paralytic squint. So in paralytic squint, क्या हो रहा है? Suppose you are looking towards the right. Your right eye is moving, but your left eye is not adducting. समझो? Then there are two images. When there are two images, you will not have the sense of the depth. When there are two images forming, there's no sense of depth. So that is the reason there will be no stereopsis. There is no stereopsis, is what you need to remember. So diplopia is the main symptom. There's a confusion, nausea, vertigo, loss of stereopsis, ocular deviation, etc. So primary deviation is an abnormal eye, secondary deviation is in the sound eye, and secondary deviation is more than the primary deviation in case of the paralytic squint, which is also called concomitant squint, is what you should remember. So diabetic retinopathy, it is duration dependent, age of onset, intensity of the poor glycemic control, they're all the determining factors. So duration of the disease is the most important and best predictor of retinopathy. So it is extremely rare for the diabetic retinopathy to develop within 5 years of onset of the disease or before puberty. 18-year-old girl who was using spectacles for the last 10 years comes with photopsia, sudden loss of vision. So typically last 10 years spectacles means, what do you expect, doctor? She must be a high myopic patient. Now she presents with photopsia, floater, sudden loss of vision, and the diagnosis is retinal detachment. And how do you investigate? By doing indirect ophthalmoscopy is what you should remember. Vision 2020 goals include trachoma, cataract, refractive error, etc., etc. The right to sight is the global joint initiative of WHO and the International Agency for Prevention of Blindness. So cataract, trachoma, onchocerciasis, childhood blindness, refractive error, and low vision, they're all the preventable major causes of the blindness which are being addressed in the Vision 2020. Proptosis, where do you see? Typically, proptosis is a feature of neuroblastoma, is what you should remember. So there will be congenital conditions, traumatic lesions, circulatory disturbances like orbital varices, anything can cause. Certain tumors, mucoceles, etc. So I leave the literature for you, doctor. Then if there is no tear film, what is it called? Keratoconjunctivitis sicca. Absence of the tear film. So tear film has innermost thinnest mucinous layer secreted by the goblet cells, crypts of Henle and glands of Mange, and it wets the cornea by converting the corneal epithelium from a hydrophobic into a hydrophilic surface. The intermediate layer of the tear film, this is also another favorite MCQ. It is the aqueous layer secreted by the lacrimal glands. It has antibacterial function. So that is the reason, just if lacrimal gland is not there, tears will stop. वैसा कुछ भी नहीं है, क्योंकि contribution of the lacrimal gland is only for the intermediate layer, not for inner and outer layer. Outer layer is lipid layer. Tears में lipid भी होता है. Tears में oil भी होता है, and that is produced by meibomian gis and mole glands that mainly lubricates the eyelids. Ptosis with weakness of orbicula and oculi is a feature of myasthenia gravis. Now, what is Fisher syndrome, Dr. Miller-Fisher syndrome? कभी सुना क्या? It is a variant of Guillain-Barré which produces ophthalmoplegia, eriflexia, ataxia with anti-ganglioside antibodies which are being found. It is a variant of Guillain-Barré is what you need to remember. Washious ring. This will be an image-based MCQ in the tomorrow's NEET PG. Be very sure, doctor. Concussion injury. The mother of 1.5-year-old child, white reflex in one eye. Immediately, retinoblastoma, you will jump and answer. Floaters kahan hota hai? In uveitis, retinal detachment, vitreous hemorrhage. There are all the situations where you get muscae volitantis, which is the floaters. So any vitreous degeneration like senile degeneration, pathological myopia, any inflammation like uveitis, either anterior, posterior or pan-uveitis, endophthalmitis, any retinal tear, anything can lead to development of floaters. Pillion's dehiscence leads to pharyngeal pouch. Post-cricoid carcinoma, you treat it with laryngo-pharyngosophageectomy. Eustachian tube का length क्या होता है डॉक्टर? 36 millimeters. Meniere's disease में fistula test is usually false positive. भैया ये fistula test के बारे में जरा हम ध्यान से पढ़ाई करेंगे. See doctor, I will try to rush through the answers. My main intention is to remind you, भैया ये पढ़ो, ये जरूर आएगा. इसको फिर जाके 2000 HD वीडियोस में रिवीजन करो. वो बोलने के लिए मैं रोज ये लाइव क्लास कंडक्ट करता हूं आपको. Otherwise, a detailed revision, already 2000 HD videos are available on the Incus app. You need not worry. So fistula test, using Seagull speculum, intermittently there is a pressure of the tragus or Seagull speculum. This pressure changes in the external canal are transmitted to the labyrinth, horizontal semicircular canal, that stimulates the labyrinth and result in nystagmus and vertigo. Normally this is negative, because any pressure change in the external auditory canal cannot be transmitted to the labyrinth. That's the reason. So when will the external ears pressure changes reach up the labyrinth? If there is any erosion of horizontal semicircular canal, like in cholesteatoma, or you have done any fenestration procedure where you created a window to horizontal canal. Similarly, any post-stapedectomy fistulas or the round window, rupture of the round window membrane. But whatever it is, if you apply pressure in the external auditory meatus, if you need to get the nystagmus in vertigo, first of all, your labyrinth must be alive. Agar labyrinth mar gaye, if the labyrinth is dead, then fistula test become negative. So, a positive fistula sign is post-stapedectomy, cholesteatoma eroding lateral semicircular canal, etc. Dead labyrinth will lead to absent fistula sign. False negative fistula sign. If there is a fistula but there is a overlying cholesteatoma or tumor, even though there is a fistula, fistula test will be negative. And false positive fistula sign. Really fistula is not there. But if you apply pressure in the external auditory canal, there can be development of nystagmus. That is seen in Meniere's and congenital syphilis. It's called henny bird sign. Henny bird sign is a false positive fistula test. Why do you see that in congenital syphilis? Because the stapes foot plate is very hypermobile. Similarly, in Meniere's disease, there is a fibrous band connecting the utricle macula to the stapes foot plate. That is the reason any pressure change in the external auditory canal will transmit to the labyrinth. So they are responsible. Even though fistula is not there, fistula test will be positive. That's the reason it is called false positive fistula test of Hennibal, is what you need to remember. Septic tonsil. There's a pus in the tonsil, enlarged, palpable, gigolo, digastric lymph node. There's a congestion of the anterior pillar, etc. Vasomotor rhinitis is all allergic, nothing to do with infection. Laryngeal malignancy, most commonly squamous cell carcinoma. Malignant positional central nystagmus. How will be the vertigo? It is mild, less than expected. Once more, doctor. Very important MCQ in the tomorrow's NEET PG. Table ko dhyan se padho. Latency is generally there in peripheral nystagmus, whereas in central it is unusual. The vertigo and nystagmus both will start immediately. There is a torsional, upbeat or horizontal nystagmus, whereas pure vertical, usually downbeat, is central. Fatigue is usual in peripheral. Vertigo is severe in peripheral. Localization is, what is the source of the vertigo? Posterior or horizontal semicircular canal. Whereas brainstem or cerebellum is the cause for the central or malignant vertigo. Superior meatus of the nose. It occupies middle 1/3 of the lateral wall. And superior meatus is the smallest of the three meatuses of the nose. Primary atrophic rhinitis. It is common in females. Poor hygiene. It is racial. They're all true. For detrusor instability, what is that muscarinic receptor antagonist that you use? Fesoterodine. Fesoterodine is the one which you use. It is a competitive, non-uroselective muscarinic receptor antagonist and is a prodrug. The skin of the fetus shows scarring. Where do you see that? Whenever varicella infection is there, maternal varicella, it can lead to the development of this cutaneous scarring. Similarly, hypoplastic digits, muscular atrophy, paralysis, seizures, chorioretinitis, optic disc hypoplasia, they're all the features. Ventriculomegaly in the fetus. The ventriculomegaly in the fetus. It is caused by cytomegalovirus. A 40-year-old woman has a small ulcer on the vulva. The clinical examination reveals solitary ulcer on the labia, a well-defined margin, indurated base, non-tender, with a painless linguinal lymphadenopathy. What else is needed? That is a classical syphilis, the primary chancre. A 28-year-old woman referred by the endocrinologist because of the increased facial hair. Which drug? Hirsutism is a side effect. Spironolactone. 5-alpha reductase inhibitor is finasteride. Danazole typically is anti-gonadotropin, anti-estrogen, anti-progesterone, and a weak androgen, which will cause endometrial atrophy, hence used in treating excessive bleeding. Menorrhagia is what you should remember. Hormone replacement therapy. Whenever there are severe vasomotor symptoms in postmenopausal women, you give HRT. Lichen sclerosis, any vaginal cancer, it is not associated. But type 1 diabetes, alopecia areata, which is autoimmune, or primary biliary cirrhosis, any of them can be associated. And a local steroid, clobetasol, is used for treating the symptomatic women. Premature ovarian failure, it can lead to low estrogen, leading to osteoporosis. It is often seen with Turner syndrome. FSH-LH will be typically, just like in menopause, elevated. It is an X-linked recessive disorder, Duchenne's muscular dystrophy. All the list you should know, Doctor. Becker's muscular dystrophy, Duchenne's muscular dystrophy, G6PD deficiency, complete androgen insensitivity, congenital aqueductal stenosis, they are all X-linked recessive. Hemophilia. If you do chorionic villus sampling in early pregnancy, you can make a antenatal diagnosis. Epidural anesthesia is allowed if the factor level is more than 40, and cesarean section may be carried out if indicated. So what is the definition of oligozoospermia? World Health Organization ने ISO standard लगाया semen को, अच्छा quality semen, बुरा quality semen. So oligozoospermia means the count is less than 20 million per ml. Once more, doctor, examiner will leave a seminal fishy smell in the exam hall. You have to be 100% sure to face the examiner's question. It's like you should go with all preparedness and attack the examiner. You should not be afraid about examiner. To assess the ovulation, what do you use? You do ultrasound, egg size बढ़ रहा, egg size नहीं बढ़ रहा, egg size बढ़ रहा, egg size नहीं बढ़ रहा. Follicle size. So only basal body temperature will help you. Mid-luteal serum progesterone will help you. Serum LH is only to know the ovarian reserve whenever you are treating a case of infertility. Twin pregnancy. Monochorionic twins have a perinatal mortality 5 times more than the dichorionic twin pregnancy. And the incidence of monozygotic twinning is relatively constant. And the incidence increases with the ovulatory induction. Dichorionic twins. Typically, they are different sex, 2 placentas, and lambda sign positivity. And the dividing membrane is more than 2 millimeters. So you should know what are all the ultrasound features of dichorionic twins. Once more, doctor, there are about 80 videos of 20-minute duration in the Incus app. आप तुरंत डाउनलोड करो और 2000 HD वीडियो प्रोग्राम में सब्सक्राइब कर लो, शांति से टॉपर बन जाओ. आजकल coaching gurus also are becoming commercial advertisers, right? So, but still what I want to tell you is, we really want to help you. Any coaching guru want to really help only, right? So, 2 placentas, distinct separate sacs in the first trimester. They're all the ultrasound features. Contraception. The moment you start taking combined OCPs, there's a timely return of the normal fertility. Sheehan syndrome. The postpartum pituitary necrosis. It presents with adrenocortical insufficiency, lactational failure, and hypothyroidism. That's how Sheehan presents. What are the indications to switch to continuous fetal monitoring from intermittent auscultation? If you are using oxytocin for augmentation of labor, if there is a maternal pyrexia, if there are abnormal fetal heart rate pattern detected on intermittent auscultation, they are all the indications. Perineal trauma during childbirth. To reduce, we do episiotomy to assist the instrumental delivery is what you need to remember. There is no role for any routine episiotomy for a spontaneous vaginal birth. Even if there is a previous history of 3rd or 4th degree perineal tear, don't give episiotomy as a routine. Max sulfate toxicity, 2 to 4 is considered to be what? Therapeutic range only. And max sulfate can cause both oliguria, anuria, reduced deep tendon reflexes, respiratory depression, etc., etc. Mayer-Rokitansky-Kastner-Hostner syndrome, where Mullerian agenesis is there. They have a female phenotype. But Mayer-Rokitansky can be associated with skeletal abnormalities, renal abnormalities. Secondary sexual characters are normal. You should know all those things. So double ureter, horseshoe-shaped kidney, they're all the renal abnormalities. Familial, Kalman, androgen insensitivity, they're all primary amenorrhea. But Asherman is endometrial syncytia. Already menses started, but after recurrent uterine scratching, that lead to endometrial syncytia, leading to secondary amenorrhea, not primary. Now, pre-eclampsia. What are the risk factors, doctor? Women in their first pregnancy, teenage pregnancy, older women, women with new partners, twin pregnancy, hydropic babies, hydatiform mole, long birth interval, women with medical disorders. You should know everything, anything about preeclampsia. Sure, short topic in obstetrics. Now, with regard to the hemolysis, elevated liver enzymes, low platelet syndrome, HELLP syndrome is associated with 2 to 4% maternal mortality. In previous pregnancy HCLP हुआ तो इस pregnancy में 55% risk. And peripheral smear अगर करें तो there is a hemolysis indicated by Bursell's and polychromasia. They're all true. And the overall recurrence rate in subsequent pregnancy is almost 20 to 25%. Thrombotic thrombocytopenic purpura is a vasculitic purpura, TTP. It is not due to thrombocytopenia. And there is a microangiopathic hemolysis. And it can have fever, seizures. That's called Raynaud's pentode associated with TTP. Laparoscopic ovarian drilling in PCOD treatment. The ovulation occurs in 80% of patients. It is as effective as gonadotropin therapy and it is useful in clomiphene resistant PCOD. They're all true statements. Clomiphene resistant, clomiphene देने के बाद भी ovulation नहीं हो रहे तो laparoscopic ovarian drilling करना पड़ेगा. Now, dysfunctional uterine bleeding. How do you reduce the menstrual blood flow? Antifibrinolytics like amino caproic acid, epsilon amino caproic acid, prostaglandin synthase inhibitors, combined oral contraceptive pills, levonorgestrel containing IUCD. They're all being used. With regard to the hirsutism, PCOD में hirsutism, congenital adrenal hyperplasia में hirsutism, idiopathically hirsutism, but androgen insensitization syndrome में lack of hair. There will be no hair at all in axillary and pubic area. PCOD, there is increased estrogen. In fact, the only condition where there is amenorrhea associated with increased estrogen levels is PCOD. And the women with all that high estrogen are at a risk of endometrial hyperplasia, endometrial cancer. And also there is hyperinsulinemia. That is how, doctor, we finished 100 questions today. Every day, 100 MCQs, full-scale grand test on the Incus app. Discussion with Dr. Murali. I will hold your hand and take you to become the winner. We fight on the land, we fight on the air, we fight on the water to win the enemy army, said Winston Churchill. Similarly, you should fight, fight, fight. No looking back, because the only purpose of our life, having become a medical student, is to become a great consultant for which we are being born and save millions of lives in another 30 years of career. So only with that dream, without giving up, prepare well for the exam, doctor. My huna aapke saath. Who will stop you from becoming a topper? Good night. We'll once more see you tomorrow evening at 6 o'clock.